Alrighty, so based on your assessments and after showing you some of the plaque buildup on your teeth after we went ahead and did a plaque staining, I'd like to go ahead and review a few things with you for your OHI if that's okay with you. Okay, so great, let's go ahead and get started. We're going to get started with a few questions first before we review things. So I wanted to ask if do you know exactly what plaque is? Okay. And from a scale 1 to 10, how confident do you feel about your at-home care? Hmm. So it's something you feel like you still need practice on? Okay. And what exactly keeps you from flossing? I noticed that you had listed that you don't floss every day. What do you feel like is it's what's keeping you mainly from flossing? Alrighty, great. So, a few things I'd like to go ahead and review with you. So, because you are at a higher risk of periodontal disease, it's going to go ahead and be crucial. It's critical that you go ahead and brush and floss and use your mouth rinse on the daily basis. So I'd go ahead and recommend using a manual soft bristle toothbrush with a modified Bass method for brushing. I think that'd be great for you. It'd be really good for you because it meets your needs for in regards to perio, the gum recession you might be seeing. And it also helps with that limited dexterity you mentioned, because I know brushing can be a pain on your wrist, especially if you have things like arthritis. So let me go ahead and take a second to show you what the Bass method looks like, okay? So the type of brush I would recommend would be kind of like this one. This is a soft bristle toothbrush by Tepe. You can see how many bristles it has. Fairly soft. This is going to be great for your teeth. It's not going to be very abrasive. It's what we're looking for. And for your Bass method, what you're going to want to go ahead and do is you're going to be at about a 45-degree angle. You're going to be sweeping back and forth motions. And at the end, you're going to sweep down. Back and forth, and sweep down. Back and forth, that angle, and sweep down. You're going to do that throughout the whole arch. It may take a little practice, which is understandable, but it's something I'd strongly recommend for you. So something else I'd recommend for you is an electric toothbrush. I feel like that's something that you benefit from quite a bit. I know they can be a little pricey, but with your limited dexterity, I think it'd make it a lot easier for you, a little bit more convenient. So we really want to have you try to brush twice a day. It's going to go ahead and decrease the risk of caries and improve your gum health. It's going to be important to maintain good oral hygiene. Get rid of that bad odor you had mentioned. So like I mentioned, it's important to have that soft bristle brush, as it's going to help with your enamel, and it should help with the bad breath. So moving forward, to prevent cavities, since you are a little bit more prone to cavities, using a toothpaste containing active fluoride or stannous fluoride is something I'd really recommend for you. It's going to go ahead and improve your gum health. It's going to reduce bleeding while simultaneously helping you prevent those cavities. Periodontax is a good example of a paste I would recommend for you. Now for flossing is going to go ahead and be very important. It's a very important step to a good dental routine. I know flossing is going to be very challenging though for you, since you do have that limited dexterity. So in this case, I get it's tricky to floss, and it's time consuming, and I know that's something a lot of our patients lack, is time to go ahead and do it. So in this case, I'm going to go ahead and recommend a water pick or water flosser for you. I don't unfortunately have one on hand to go ahead and show you how to use it, but they should come with instructions. Different companies have great different water picks, like Sonicare has a good water pick that I'd recommend to most of my patients. But it's going to go ahead and help in those interproximal spaces, so like in between your teeth, or get all that food or debris that gets stuck in there. So it should definitely help with your gums and the bleeding, the bad odor you mentioned. So one last thing I'd like to cover is the mouthwash. I strongly recommend you use a mouthwash with xylitol. It's going to really help eliminate that bad breath you mentioned, and it should help with xerostomia, because you are a little prone to xerostomia. I think that might be why you're experiencing that bad odor, is because you have a dry mouth. So xylitol is going to go ahead and help with the dry mouth and the bad odor you're experiencing. A good brand I think I would recommend was the TheraBreath Plus, the mouthwash. It's a good example that I go and recommend for you. It's gonna help with the bad odor. It's gonna kill that bacteria, and it should help with the dry mouth. One last thing I'd like to discuss with you. I think this is the trickier portion of the recommendations and the oral hygiene routine that we want to go ahead and build is we're gonna want to slowly but surely implement some lifestyle changes to go ahead and help and improve your oral health and your overall health. I think it's going to be a crucial step for us to go ahead and see that progress we're looking for. I think it's a critical step to go ahead and minimize that smoking, and trying to eat a fewer high sugar foods. I realize that's a lot. It's not as easy. It's a lot easier said than done. But it's going to be a crucial step to go ahead and make the progress we're looking for. I realize it can be very difficult to implement, and that's okay. It's not something we're expecting to change from one day to another. We just need to try to slowly implement things or steps to go ahead and improve that routine and improve them on the daily. And after all, I'm here to help you for that. We can together we can come up with a plan to go ahead and minimize the high sugar foods and the smoking. But overall, that's kind of my recommendations for you. Do you have any questions for me? Okay, and if you have any concerns at all, you can just go ahead and call our clinic. I also have my website. I'll go ahead and link it on a little notepad for you. That way you can reference it if you have any questions. But overall, those are the oral hygiene recommendations I have for you and the instructions. Feel free to reach out if you have any questions. Thank you.